Sharee, it's really good to see you coming out of the hospital. I know this was a long admission for you, so I'd love to hear about what happened and what brought you to the emergency room. And then once we, hear about that, remember this is our final visit for transition before you go off to college.
I went to the movie theater usually. It was really cold in there. Really cold. So I had to leave a little bit early. I should have been better prepared. I didn't bring a jacket or a sweater. So I left, started the usual things. Took some ibuprofen, hydrated, drank a lot of water, took my pain medicine, even got in my bed, tried to get warm and just relax a little bit, but it just got worse and I had to go to the ED.
What did you do to relax?
I just put on some music, made sure all the lights were off, turned the heat on, of course, but nothing really worked.
And what did they do for you in the ED?
The usual, oxygen and fluids, but this time they gave me something called Dilaudid. Morphine wasn't working anymore, and I don't know why, but it definitely was a different feeling, more euphoric. I guess I'm just a little nervous.
And what about the Dilaudid made you nervous?
Well, I hear a lot of times that sickle cell patients can get addicted to the medicines, and this was much stronger than morphine. And that just makes me a little worried.
So I'm really glad that you're thinking about these issues, especially because you're going to be off without family support in college. And so it's important to understand how these medicines affect your body. Now, I do want to make a distinction between addiction and dependence. And dependence is something that can happen with these sort of medicines. They're called opioid medicines, as you know. And your body kind of gets used to them. And that's called tolerance. And we sometimes see that after years of using the same opioid medication, your body no longer responds to it as well, and you just don't get the same sort of pain relief. And so one response to it is to increase the dose, but sometimes we have to switch to a different type of opioid medicine, which is what they did, it sounds like, in the emergency room. Because of those changes in how your body responds to it, it also can lead to something called dependence. So if you're on an opioid medicine for a long time, your body sort of becomes dependent on it, and when you stop it too quickly, it can lead to uncomfortable symptoms that we call withdrawal symptoms. But addiction is different. So addiction is a situation where your body starts to crave it, and it impairs your ability to function in life because your body and your mind are so focused on getting this medication. And I've never seen you be in that situation, and the fact that you're cognizant of that possibility, I think will help me and your doctors help you to stay safe and use these medications wisely.
Okay. But they sent me home with some, and I guess I'm just concerned, like, my parents aren't going to be in charge of my medicine, especially because I'm going off to college. So what do I do now?
So you do have a visit set up with the pharmacist after you see me.
Okay.
And the pharmacist is going to help you taper your medication. So one of the things that opioid medications do is set up a sort of dependence where if you are on it for a long time and then you stop too soon, you can develop these uncomfortable symptoms that we call withdrawal. So if you taper the medicines from a high dose slowly to a low dose, it can help prevent those symptoms.
Physical therapy. I did that a couple of times in the hospital. Do you think you want me to keep doing that?
I think it's a really good idea. So we used physical therapy in the hospital because the pain was keeping you in bed for many days in a row, and when you don't move, your muscles become weaker. and that just makes the pain worse and last longer. So that's why we use physical therapy in the hospital. But I do think it's a really good idea to use it as an outpatient, so that way you can learn stretches and exercises that are appropriate for your level of fitness to help maybe prevent some of these crises. So, if we use physical therapy on an outpatient basis, maybe your future pain crises will be less severe.
Okay.
There are, other ways to manage your pain besides opioid medication. And then I was wondering if you would be interested in seeing an acupuncturist.
Okay, wait, acupuncture, isn't that with like needles and stuff?
It is with needles, and I know that you've had a lot of experience with needles, and it's not your favorite. I can understand that. But acupuncture uses a very special type of needle that doesn't cause pain. And I don't know a whole lot about it, but it seems to potentially be effective in reducing pain.
Okay.
It might be helpful to go and talk with the acupuncturist and see what he has to offer. I think you'll be pleasantly surprised. And, it's a technique that's been used in Asian countries for centuries.
Okay.
So
I'll give it a try.
Might be some use to you.
Okay.
Okay. So let's move to the transition part of our visit. Have you made a decision about where you want to go?
I haven't just yet, but I have been accepted to my top 3 choices.
Good.
Just haven't picked one just yet.
Okay. And I know they're all pretty far away?
Yeah.
Okay. Over the years, we've had a lot of transition visits to help prepare you for that change. And so far, I think you're becoming independent in terms of calling for appointments and asking for medication refills. And you've been pretty good about getting your lab work to monitor your blood counts on the hydroxyurea. Because I will not be able to see you, that means that we're going to have to find doctors in your area who you will be able to see on a regular basis and also be able to call in an emergency. Okay. Are you going to have a car?
Probably not. I'll probably stay on campus. But I did have a question.
Okay.
How are they going to know anything about me, like my charts, my info? Like, what if I need a blood transfusion like last time? I don't know how that's going to get to them.
That is a really good point, and that is why I want to know who you're eventually, or which college you're eventually going to go to, so that way you and I can research, okay, how do we contact the University Health Center? If you don't have a car, that's most likely going to be your most accessible medical clinic, but you also need a hematologist, so someone like me, but who takes care of college students and adult patients, and hopefully someone who is familiar with sickle cell disease, okay? And if you needed a transfusion, it would generally be the hematologist who would help to arrange that, okay? And once we establish who those people will be, then I will be sure to send them all of your information with a complete summary of what type of sickle cell disease you have, what medications you're on, what sort of complications you've experienced, and especially, what you do to manage pain, because I want them to be familiar with that, especially, if you need to go to the emergency room or be admitted there, I want them to know what protocol works for you.
I guess taking away everything and being a part of PED so long, I just want to make sure that I spread the word and make sure that we take care of ourselves and make it an issue to really get to know our medical team.
I think you will be successful.